Since I spoke to you last Monday, we've seen further clusters of the B.1.617.2, the variant first observed in India. And we've seen it especially in Bolton, in Blackburn with Darwin and some other parts of the country. At this stage, there are some important unknowns. We believe this variant is more transmissible than the previous one. In other words, it passes more easily from person to person, but we don't know by how much. I'm told that if it's only marginally more transmissible, we can continue more or less as planned. But if the variant is significantly more transmissible, we're likely to face some hard choices. And we're going to be learning a lot more in the coming days and weeks about that. The good news is that so far we have no evidence to suggest that our vaccines will be less effective in protecting people against severe illness and hospitalisation. So that means we're in a different position from the last time we faced a new variant before Christmas because of the scale of our vaccine rollout, which Public Health England estimates has already saved almost 12,000 lives and prevented over 33,000 people from being hospitalised. So I believe we should trust in our vaccines to protect the public whilst monitoring the situation as it develops very closely, because the race between our vaccination programme and the virus may be about to become a great deal tighter. And it's more important than ever, therefore, that people get the additional protection of a second dose. So following advice from the Joint Committee on Vaccination and Immunisation, we will accelerate remaining second doses to the over 50s and those clinically vulnerable right across the country, so that those doses come just 8 weeks after the first dose. And if you are in this group, the NHS will be in touch with you. We will also prioritise first doses for anyone eligible who has not yet come forwards, including the over 40s, and I urge anyone in those groups to come forward as soon as you can. At this stage, there is no evidence of increased cases translating into unmanageable pressures on the NHS, even in Bolton, and infections, deaths and hospitalisations nationally remain at their lowest levels since last summer. So, and this is a balanced decision, I do not believe that we need, on the present evidence, to delay our roadmap, and we will proceed with our plan to move to step 3 in England from Monday. But I have to level with you that this new variant could pose a serious disruption to our progress and could make it more difficult to move to step 4 in June. And I must stress that we will do whatever it takes to keep the public safe. Our surveillance and data gathering is now so advanced that if there was a danger of the NHS coming under unsustainable pressure, we would see the signs in the data very early on and could react in good time. And that gives us the confidence to continue moving forwards for now. But I urge everyone to exercise the greatest caution, because the choices we each make in the coming days will have a material effect on the road ahead. To those living in Bolton and Blackburn, I'm very sorry that you're once again suffering from this virus, and I know how hard it has been for you, having been in a form of national or local lockdown for longer than almost anywhere else. But now it's more vital than ever that you play your part in stopping the spread. So we won't be preventing businesses from reopening on Monday, but we will be asking you to do your bit. Take the vaccine when you can, get your free twice weekly rapid tests, and if you do test positive, you must self-isolate, and we'll provide financial support to those on low incomes to help them do so. As we move away from living our lives by government rules, and as we learn to live with this virus, then, as I said on Monday, we need to make our own decisions about how best to protect ourselves and our loved ones, informed by the risks. And for those living in Bolton and other affected areas, there is now a greater risk from this new variant, and so I urge you to be extra cautious.